Okay, so the more I think about this, the more it's coming clear that there has been a change in the diagnosis and a change in how cases are counted, and it's spelled out right here. So on August 6th, the case definition for coronavirus disease, COVID-19. Now, it should now. How can I explain this? See, the virus, it's called SARS-CoV-2 or coronavirus. Okay. That is the virus that is in your body, turns into COVID 19. So you don't have COVID 19 when you have the virus unless the virus is attacking your body and you end up sick. That's when you get COVID 19. It's the coronavirus disease. So what's going on here, which is that if you test for the virus, you become a corona disease case. Now that changed on August 6th. Now I would imagine that all the other cases that were positive were done in hospitals and in clinics by a physician, and they would input it themselves. But in this case, you're bypassing the physician and you're keeping the same name as what was entered as a physician instead of going to the name of the virus. Okay, fine. Presumptive case. Based on an evolving situation with COVID 19, there is no longer a presumptive confirmed case definition for surveillance purposes. Okay. I don't know what was there before, so it's interesting. So, confirmed case is a person with a laboratory confirmation of SARS-CoV-2 infection. Okay, so you're confirmed to have the coronavirus infection using a validated assay consisting of, okay, so all normal stuff. Okay, so a person, if you are positive with the SARS-CoV-2, so it's being tested properly by the lab technician, but the definition has changed. It's not being listed as a SARS-CoV-2 infection. For clinical testing purposes, health professionals who are involved with the assessment of management for possible coronavirus, so COVID-19 cases, are encouraged to consult tables 1 and 2, a daily WHO's situation report, and inform their decision making. So, reading it again, this page provides the testing guidance for the novel coronavirus disease, formerly known as nCoV, associated with an outbreak of respiratory illness that originated in Wuhan, Hubei province in China in the late 2019. The causative agent of COVID-19 disease is SARS-CoV-2 virus, and for the purpose of clear communication, PHO, who is PHO? Public Health Ontario, uses the term COVID-19 to refer to both the virus and the disease. Case confirmation. Some hospital and community laboratories have implemented COVID-19 testing in-house and report a final positive result, which is sufficient for case confirmation. Other hospitals and community laboratories will report positive as a preliminary positive during the early phases for implementation and will require a confirmation testing at a Public Health Ontario laboratory. If confirmatory testing is requested, this should be indicated in the test requisition by the submitting hospital and community laboratory. So they're not doing the serology. What is good about the serology is that it kind of shows you how you're coming along with just not having it spread anywhere. And again, this is another thing that's very suppressed. So here we find it down here. PCR testing, also known as polymerase chain reaction testing, is a type of test that tells us if somebody currently has COVID-19. No, it currently tells you if you have SARS-CoV-2 infection. This is in contrast with serology testing, which tests someone's blood to see if they have generated antibodies in response to COVID-19 infection. This primarily tells us if someone previously had COVID-19 and find out more about the differences with these two types of tests and their applications. Okay, so serology is that you've had it and you're immune, and the PCR is if you have the active virus. Okay, fair enough. There's nothing to, let's see, I don't think there was anything crazy about that. The serology testing examines the person's blood to see if they have the antibodies for COVID-19. Antibodies are produced by the immune system in response to the infection of the bacteria and virus. Antibody testing is specific in COVID-19 antibodies, and therefore is useful to find out whether a person has been exposed to the virus. In contrast, PCR testing, also known as polymerase, is a type of test that tells if someone currently has a COVID-19. Application of serology. Due to significant gaps in understanding of the COVID-19 immune response, serology testing currently has very limited clinical value for individual patients. How convenient. How convenient. Also, when a vaccine becomes available, serosurveillance could help determine prior grounds for the vaccination and help monitor the effectiveness of a vaccination program. Public Health Ontario is currently running a large COVID-19 serosurveillance initiative in Ontario using samples submitted to PHO laboratories for testing in late March. Partial support of this initiative has been provided by the Immunity Task Force. Find out more about the initiative. I might join that. This is a good idea. This is really the proper way of doing it, because what it is collecting random blood samples. Go give blood, whatever. I think they want to keep it as random as possible. They don't even want to know. Just go get blood, and they go and look and see if it's kind of been moving around in areas. Compare that with actual people who are sick, and see there might be some people who have antibodies for it, but they have no cases. And that will tell you is that a much milder, much more virulent strain of the coronavirus, of SARS-CoV, because they do mutate. Every time they mutate many, many times, and they will kind of like, let's say, every one time they will mutate into more dangerous, 2 more times they will mutate into less dangerous. Because if it mutates into a more dangerous strain, it won't last as long. It will die off faster because it's making the patient sicker and they react differently. So if the virus itself becomes like 10% more deadly, it's going to die off 5% faster. If it mutates to be 10% less deadly, it's going to continue to live that much longer. So you see what I mean? If you understand what I'm saying, the deadlier the virus, the faster it dies, that strain by itself, and it goes away. And then the strain that is less deadly and more virulent will increase to the point where it will spread around the world and you'll barely know it. And this happens all the time. This is the common cold. There's all kinds of viruses that float around that you get and you don't barely know you got it, because it's adapted to your body and it's virulent. And if you knew you had it, then you would it's alive because it's invisible. Okay, so over here we got now. This is the chart that they show. Okay, so daily new confirmed COVID-19 cases, and this I think is very, very misleading, because we got here confirmed cases and confirmed deaths, and you see the difference. The confirmed deaths drop and stay down, and the confirmed cases flip up. And the reason why they do that is because they changed the definition of the disease in August 6th, that a positive coronavirus test is now listed as a COVID-19 diagnosis, which used to be the complications of the coronavirus that would bring it to the hospital, and you would need the treatments, you would need that you would require a doctor's assistance, and they would classify it as you go through the health care system as COVID-19, not positive with coronavirus. But until you are diagnosed and until you're in a hospital, until you get the treatment, until all that stuff, it really is not the right name to call it COVID-19, and it messes up the data. Because now, instead of the confirmed COVID-19 following the death rates, it's now flipping up, and what they're confusing now is where this should be the serology. So at this point, when it's swinging up, that is the wrong test on the swing up. That test is designed to freak people out, to lock down where you're living, and it's also designed to put masks on your face and to scare you into a vaccine. It has absolutely no value. There is no value in a positive COVID-19 test past when they changed the definition or after it went down when it matched up. It was matched up until here. Okay. Let's see what date is that. It'll probably line up, I'm sure, to April, May, June, July. Okay. Okay, so this is where it starts to just kind of peter out here. And then all of a sudden, I think it was August 6th. Okay, over here we decided we're going to change the definition at this point. And it ramps up. Busted, busted, busted. Motherfuckers.